Hey everybody, it's your favorite sim whisperer, Dr. Kat, and we are going to be doing an episode of Minute to Sim. So earlier this week, I talked about virtual skills checkoffs in my this or that episode. So if you did not check that out earlier, please check it out because that kind of gives you the foundation of what I'm going to be talking about today for the Minute to Sim. So in that, I'll give you a little quick synopsis. I preferred in-person checkoffs, but I did mention the caveat that there are certain things that you can do skills checkoffs wise that could be virtual. Because the big thing with me is just like certain angles, especially because I work at multiple nursing schools. You know, nurses, we got to have multiple jobs, right? So I work at multiple nursing schools, and with some of these skills, especially like inserting a Foley, like I constantly have to kind of move the camera. I'm constantly moving, trying to see, you know, when they're putting on their sterile gloves, if their fingers are touching, or when they're trying to insert the Foley, if they accidentally closed the uterus, Lord Jesus, they accidentally closed the labia, or if maybe the Foley accidentally scraped across the patient's leg. There's so many ways that you can break sterile field with Foley catheter, to where you really have to be watching and you really need to be able to move around and kind of get the best angles for. So with that being said, there are some things and some ways that I think that a type of virtual skills checkoff could be done. And so that's what I'm going to be talking about here in this Minute to Sim It. Okay, so y'all know I got my air horn here. I got my timer. Okay. So, y'all know it's like I can't never get it done in 1 minute, but I'm most definitely going to try, okay? Do a little woosah. All right. Y'all ready? I'm not, but we're going to do this, okay? Here we go, and I'm starting the minute now. Okay, so there are some ways that you can do a virtual skills checkoff. So with smaller tasks like hand washing, like maybe head to toe assessment, those type of things where it's not really important, kind of like the angles that you're getting, but things more so like Foley catheter and those type of things. A way you could do it for that is instead of using that for your main skills checkoff, especially if you're doing something for like a competency-based type of education, hopefully once they are already competent in doing this Foley skills, maybe in like their first semester, and now they're coming back to the second semester, they need to still prove that they're competent in doing this Foley. So then maybe that could be a way that you can have them record themselves doing this Foley to recompetence themselves, but to redemonstrate their competency. Also, you could do kind of like a proctor type of thing, to where they come into the sim lab. Somebody's there, but nobody's right there in the room with them, and then they can do it, and you can record it with all of the best angles from sim lab. Woo, Lord! And that was that was 1 minute. Good grief! Where my air horn at? Almost hit drums. Woo, Lord. So hopefully that gave y'all some ways to implement virtual skills, a virtual skills lab, virtual skills checkoff. I'm definitely a huge proponent of people verifying that they are competent with what they proved they were competent with maybe 6, 8, 10 weeks ago. If you watch one of my episodes of this or that, I talked about that being one of the main bones that I pick with competency-based education. But hopefully you enjoyed it. Hopefully you got something from it. Again, the 19th is the last day to sign up for this simulation mentorship pilot program. And then also the very last Saturday of the month, I want to say it's 12 o'clock. Maybe, no, it's 12:30. The facilitator intensive course, you could definitely still sign up for that. And hopefully I will see you in one of the two. Thanks, y'all. See you later. Bye-bye.